My name is Thomas Brooks, and I'm going to be doing my SparkScreen project on addiction. Who am I? I didn't come from a troubled household. I kept my grades up and strayed away from things that could bring me down. I strive to keep a healthy lifestyle, but it troubles me to see others in bad situations. This is where my interest started. Addiction is a problem that has brought even the most successful people down to a level that no one should be at. I don't have any personal experience with addiction, but the topic seemed to be a good topic to delve into for my SparkScreen project. The research has been insightful, and I think the subject is one that needs to be discussed with more seriousness and detail. What is addiction? Addiction has been a topic included in the media, books, school lessons, and much more. This is something every person has seen or encountered at least once in their life. Having an addiction is a complex burden. There are advanced ways to find out if someone truly does have an addiction, as well as how to get that person help. There are precursors to how likely one is to develop an addiction, and once someone develops one, it is hard to come clean from it. Relapse is usually the result after an individual gets clean, but if an individual is motivated enough, they can resist the temptations of social or physical pressure. There can be physical and mental factors holding a person back from getting rid of their addiction. They will help you through the addiction through medical means or by others. Although addiction is not a foreign term, there are many layers to it that most people are unaware of. Identifying and assessing addiction. Addiction is a very serious disorder that can lead to negative consequences. Addiction also has been known as a dependence of the person's certain type of addiction. This is why it's important to see the risks and signs of addiction so that an individual will be able to get the help they need. There are many ways to assess if someone has an addiction. One way is to go through the process of taking a questionnaire for yourself or the individual. The format is made by professionals to receive the most accurate results when tested. The questionnaire format that seems most effective has four major contributors: depression and or misery, positive outlooks on drugs, high rates of stress and anxiety, and a tendency to thrill seek. These factors shape a person's score on their level of addiction. The daily life of an addict is also a large factor in identifying if they are truly an addict. Dysfunctional behavior relating to addiction affects social or work life is a cause for concern. Due to there being multiple possible causes feeding an addiction, identifying these factors is a major part to beginning to help the individual. Finding out if someone is a true case of addiction may not seem as easy as it sounds. There are ways to go about diagnosing addiction and an assortment of tools to help an individual with an addiction. Using the correct tools is key to finding the most effective way to treat an addiction. One way to assess addiction is through interview instruments. There are 6 main structured and scripted instruments used to assess addiction. The others begin to delve into more details such as the time frame of the addiction and the severity of the addiction. The level of training needed to conduct the more detailed instruments become higher and more complicated and severe as the addiction level goes up. Stress. One of the biggest factors to discuss is stress relating to addiction because they both affect and influence each other. Stress is a response to a problem or situation that could be seen as threatening or damaging. The inducement could be as simple as talking to a cashier on the way out of a store, or it could be as stressful as physical assault. Stress is a biological process that is controlled by the autonomic nervous system. When a person experiences a stress-inducing event, a part of the hypothalamus distributes the corticotropin-releasing factor into the pituitary gland, which then disperses into the bloodstream. These releasing factors cause the corticotrophin. These releasing factors cause the corticotrophin to become blocked, which creates negative feedback in the body, hence causing a stress response. Knowing this information is key in understanding why stress is a main factor in addiction. Stress is a common reoccurrence in addiction, be it drugs, alcohol, or even smartphones. There is a level of stress that is induced when our body doesn't get the craving it has been trained and repeatedly received. Stressful decisions are commonly made before an individual becomes dependent or addicted to a substance or behavior. This makes stress an effective predictor for future high levels of craving and relapse points. Physical aspects of addiction. Physical aspects of addiction. There are substances that people may become addicted to that do not have any serious or dangerous side effects if one were to stop indulging in, such as tobacco or coffee. But in addition to the plethora of issues that are associated with addiction, the biggest and most detrimental issue is that of going through withdrawals, as they can be deadly. Death can come from shock, suicide, or accidental overdose during the detoxification process, as tolerance level decreases and one's body is unable to handle the amount of drug that is used to be able to get the user high. The study of the process and symptoms of withdrawal would first come from the exploration of opioids. Becoming involved in drugs such as heroin, illegal stimulants, or opioids are to the point where physical dependence is established can be extremely dangerous. Withdrawals from these substances can include tremors, hallucinations, sweating, chills, nausea, hypothermia, etc. Involvement with drugs that can cause serious withdrawals require immediate and attentive medical supervision, as they can be deadly. Many drug users try to come clean but experience such bad withdrawals that they would rather use it again than go through the agony of trying to stop. Repetitive drug use also gives the user a rewarding feeling, so they end up feeling a physical and psychological need for their substance. This is one way that the physical effects of addiction contribute to the difficulty of breaking an addictive habit, cycle, or indulgence. As stated earlier, opioids have been the forefront of studying the addiction and withdrawal cycle because of how addicting they are, as well as how intense the withdrawal process can be. The average amount of time it takes for an opioid user to relapse after a seize is about 1 year. Treatment. There are many different treatments for kinds of addictions. Many people are addicted to phones, internet, substances, or to something, but the two most common ones are alcohol and drugs. Drug treatments were made to help addicted people to stop seeking and using them. There are multiple solutions, forms, and different time lengths to help their addiction. A very common thing about drug addicts is that almost all of them are convinced that they can stop using drugs on their own, so therefore they won't even try to go and get any treatments. Drug treatments can include behavioral therapy, which can be in a form of individual or group counseling, or cognitive therapy. Medications are another option to treat addiction, but there are many cases in which they combine medications and behavioral therapy. These therapies are usually the most commonly used ones. The combination of ones above specify the specific type of therapy and will vary based on the individual patient's needs, and also what type of drug they're addicted to. It is because drug addiction is usually a chronic disorder, and people who are treated are most likely to relapse. Behavioral therapy is a good method in treating because behavioral therapy motivates the patient to participate in any treatments by making these first steps in order to get motivated and their mindset changed. An example for replace activity is when someone is addicted to nicotine, they can replace it with a nicotine replacement product such as a patch, gum, or other nicotine replacement. The length of the treatment does matter. Usually one time is not sufficient and effective. Therefore, the treatment is a long process which requires the monitoring of the patient and multiple interventions. This long time based on the research which indicate it usually has to be at least 3 months in order to notice a significant change or even stop the uses of drugs. One type of treatment is not appropriate for every patient. Every patient needs a personalized treatment, monitoring, intervention, and service in order for the treatment to be successful. Drug addicts are usually uncertain to be able to enter a treatment. Treatment has to be ready and set for them so that they can start as soon as they finally agree to do it. Many cases have proven the fact that whenever a treatment is not ready, the patient is most likely to be lost and not doing any form of treatment. The effectiveness of a treatment just works the same way as any other chronic disease. The earlier the patient receives help and starts treatment, the higher the chance of a positive outcome. For a treatment to be effective, it has to address other needs of the patients besides their drug use. It has to be addressed with any additional medical, psychological, or social problems that they might have alongside their drug addiction. Medications are just as important as the therapy itself, especially when counseling and different behavioral therapies are combined together. Since many drug-addicted people have additional mental disorders, medications and treatments must address both problems at the same time. The money given with the grant will help the patients with their addiction by providing support group events. The events hosted at the rehab center will give the patients food and drinks they can have while conversing with other patients, allowing them to relate with one another and about what they're going through, and will motivate them to get through the treatment. Anyone who's going through addiction or presently going through the recovery process will be able to attend along with their family members. The money will be used to rent a space for the event to take place or to buy a piece of property close enough to walk to. Another chunk of it would go to food and seating along with drinks and refreshments. Why? Having someone to talk to is a very good reinforcer. Bottling up emotions can inhibit someone from getting any better, therefore the treatment would become very problematic. So telling someone your troubles can help ease individual stress, and these patients will also begin to support each other by relating with another and creating bonds and friendships that could help an individual get through treatment. This event is also affordable due to food and refreshments being fairly cheap and seating able to be also inexpensive. Overall, the project will band patients together and help them through recovery while boosting motivation and creating friendships, letting them not feel alone or in their condition only by themselves. Thank you.